Hello, ladies and gentlemen. I'm Allison Rife. I've been a critical care nurse for 7.5 years now in the state of Kentucky. In my video today on professional nursing standards, I want to discuss the Code of Ethics for Nurses. The American Nurses Association House of Delegates formally adopted a Code for Professional Nurses in 1950. The code evolved for many years, starting in the 1890s, from the time when the Nightingale Pledge was written. Previous to the formal Code of Ethics, there were several tentative codes. According to the American Nurses Association, the code arises from the long distinguished and enduring moral tradition of modern nursing in the United States. It is foundational to nursing theory, practice, and praxis in its expression of the values, virtues, and obligations that shape, guide, and inform nursing as a profession. The ANA has 9 provisions for the Code of Ethics, as stated by the ANA in their Code of Ethics for Nurses 2015. Together, the 9 provisions contain an intrinsic relational motif: nurse to patient, nurse to nurse, nurse to self, nurse to others, nurse to profession, nurse to society, and nursing to society. Relations that are both national and global. The first 3 provisions describe the most foundational values and commitments of the nurse. The next 3 address the boundaries of duty and loyalty. The final 3 address the aspects of duties beyond individual patient encounters. In a presentation done by Felicia Stokes of the District of Columbia Board of Nursing for the American Nurses Association Ethics Advisory Board, some states have incorporated the code into the Practice Act. Kentucky and West Virginia are 2 of those states. The provision I felt most drawn to was Provision 7, which states, "The nurse, in all roles and settings, advances the profession through research and scholarly inquiry, professional standards, development, and the generation of both nursing and health policy." I believe that nurses can help improve health care beyond what it has already evolved to. Who better to do so than the front line of health care? After all, we are the ones at the bedside providing care, listening to those patients and families, and collaborating with the multiple disciplines that care for our patients.